Welcome to another episode of On Call with Dr. Jason Golbin. I am so blessed today to be joined by Dr. Rich Shlofmitz, Chair of Cardiology for St. Francis Hospital and Chair of Cardiology for the whole Catholic Health Service line. Thank you so much for taking the time to meet with us.
It's great to be with you.
So Rich, I have to tell a story. When I first came to this job, I came to see you. You have to make your pilgrimage here.
Right.
And we had a wonderful conversation about really how you got started. And for me, it was incredible to hear from really truly humble beginnings how you've become Rich Shlofmitz. Give me a little flavor really for our audience of where you started, where you grew up, and how you started to make your way here.
Well, you're embarrassing me a little,
well deserved.
But basically, my parents were really very simple, nice people, but kind of simple. We grew up in East New York, Brooklyn, in low-income projects. The swamps were our playground, and I didn't know what air conditioning was until I was in high school. But my mom basically graduated third grade. My father graduated 11th, and they were just good, hardworking people. And we never knew we didn't have anything, but I knew I wanted something more, and that sort of drove me into medicine. I didn't know much about medicine. We didn't have anybody in medical background as physicians, but I felt it was something that would get me to another level. I never forget where I came from. And I think that's one of the strengths about being a physician, is you can teach people a lot of different things in medicine or in any job, but you can't teach people to be nice and caring about people. That's something that you get from your family. And if you have that, you can be a good doctor.
Yeah, that's well said, especially with all the work we're doing around experience, which is what you exude naturally. But I know you trained in the city. Why cardiology? Why not selfishly pulmonary?
And I always thought that internal medicine, the broad category, was the one that required the most thinking and had a lot of happy endings. And had happy endings that were, sort of easier to get to quickly. Okay. And cardiology really turned out to be that. It's something where you have a lot of positive impact quickly. And I said, great, I'll be a cardiologist, not knowing how long it would take. It takes 7-8 years of training once you finish. Right? You think you finish medical school and you go out and practice. Well, it's a good 8 years after that before you're actually doing it. But once you do it, it's the greatest job in the world.
Yeah, agree. Okay, so you finish cardiology, you come to practice, you start right at St. Francis, or you started somewhere else and came here?
I joined in 1987. My wife's family was from Long Island. We had 3 kids. She was close with her parents. And we wanted to be on Long Island. And St. Francis, she told me, why don't you just call them up? You heard that's the best place. And I said, gee, you don't just call people up and ask for a job. She goes, what do you have to lose? So as in most of our lives, our wives direct us in the right path.
Wow.
And she said, look, you've worked too hard. You've come too far. Just call them. And I did. And they interviewed me and I got a job.
I forgot that part of the story. That's amazing. All right, so you come on staff, you're doing CATs, building a reputation in the community. How do you get to be the chief? Because I love this story.
Basically, what happened was I was a director of the cath lab, right, and I was very busy, one of the busiest guys around. And the then president or CEO of St. Francis and the chief medical officer at St. Francis said, Rich, we don't want you applying for chairman of cardiology. You could be on the search committee, but we don't want you applying. You're too busy, just do that. And I said, fine, I didn't apply. But the CEO of the system, Alan Gersey, called me up and said, Rich, I saw you didn't apply for the chairman position. I said, well, the president and the chief medical officer told me not to, so I was just listening to what they advised. And Alan Gersey, I knew since he came here. We were very close, and he was promoted up the system from CMO to president of St. Francis to the CEO of the system. And he goes, well, I think you should apply. I go, well, if you think I will, I will. So I applied, and the people on the interview committee, there were probably around 15 of them. And the 15 people that were picked were probably the 15 people in the system that probably don't like me at all. So that interview was quite an interview. Basically quoting some of the obnoxious things I've said in my lifetime, which were very accurate, and I couldn't deny.
Well, you tell it the way it is.
I tell it the way it is. So, that interview is going not the way one would want an interview going. And fortunately, there were 15 people there, but the CEO had 16 votes. What Alan Gersey said with all his chiefs, whether it was Gary Gaselta or Boomy, he said, I picked the best person I can find, and then I let him run with it. And it's because of his vision, Alan Gersey, picking the chiefs that he felt would best help the system that allowed me to do the things that we've done since I've been chairman of St. Francis, which I'm really proud of.
So you hit on a couple of things that I want to highlight. The first is the progression of success at St. Francis. It really has been the clinical leader, certainly Long Island, if not regionally. But in the past few years, I will say it's made tremendous strides in global leadership in interventional and regular, clinical cardiology. Give me a flair. What is going on, and how is that evolving?
So you bring up that point. In a couple of weeks, I'm going to be flying down to Tampa. I'm giving a grand rounds. And it's one of the interventional cardiologists I know pretty well. And I said, what do you want me to talk about? My area of expertise is interventional imaging with optical coherence tomography, which we developed the algorithm for it here around 10, 15 years ago. I said, is that what you want me to talk about? He goes, no, anyone can talk about medicine. I want you to tell me how you took St. Francis Hospital from a community hospital in Roslyn to one of the premier hospitals in the world. He goes, it's not Harvard, well, it's not Stanford, it's not Johns Hopkins, yet you are equal or better than any other academic institution. You need to tell us the story, how you did that in 10 years. The fact is that since I've been here, the clinical care here is outstanding. And that's great on Long Island or Nassau, Suffolk, Queens, but we really didn't have a reach outside the area. That was it. We were here. We were great clinically. And then, fortunately, my son went into medicine, and he was at some other institutions. Said, Dad, the volume you do and the outcomes you have, how do you not do research and get this known? So I said, I don't have time to do research. He goes, I'm going to help you. So we did 2 single-center studies, my son and I, at St. Francis, and we published them, and we actually presented them at a meeting. I said, oh, this is pretty cool. He goes, okay, now you got to go to the next level. Instead of just single center, what you have to do is get involved in a multi-center trial. And there was a book, and I'm forgetting the author, but how Bill Gates got started, and several people in industry got started. It's a matter of skill, timing, and luck. And I happened to be in a position during angioplasty when it was a brand new thing, so I had tremendous volume, so we got pretty good at it. And certain technology was new. Calcium ablation with a technique called orbital atherectomy was new, and imaging with optical coherence tomography was new. And those 2 things complemented each other. And because we were getting involved in clinical trials, and I got involved in those 2 things, and our volumes were so good, and our results were so good, we were number 1 in all the trials. And when you're number 1 in the trials, not just in enrolling, but quality and outcomes,
everybody sees it.
Well, now all of a sudden they want to get you more trials. And then it started taking off.
It rolled.
And I brought in legendary people like Jeff Moses, Ziad Ali, Alan Jeremias, Jaffa Khan, my son Evan. So many people, Omar Khalik, from all over the world. And they wanted to come because they saw something here.
They wanted to come. It was a pull.
They wanted to come because they saw that this was an exciting place where they could do what they wanted to do without a lot of red tape from university, and great outcomes, great volume to do it, and an administration behind it. So we brought these great leaders. Now we're doing clinical trials. We're starting trials. Now all of a sudden industry, instead of just wanting us in trials, is bringing new technology. So St. Francis is the showcase for all this new technology. We're the first in the world many times, doing things that nobody else is doing. And we're ahead of that curve there. I said, what could I do? And to me, the next level for CHS and St. Francis was education. And we have built a studio at St. Francis, and once a week we do live cases. We have docs from all over the world who are leaders in the area come here, they work with us, and we travel everywhere. We have this foundation with a hands-on course where we're training people to do the things that we're expert in, whether it's structural heart disease, valvular heart disease, interventional imaging, electrophysiology, heart failure. We travel all over the world. In fact, I have privileges in many hospitals in Europe and the United States where I do live cases that are broadcast. So the message is great clinical program, clinical research, an amazing faculty, new technology, and then give back with education. And that's where we are right now. We're not the number 1 place in Long Island for imaging and physiology or structural heart disease. We're not the number 1 place in New York. Frankly, I feel we're number 1 place in the world, number 1.
Agree. And I love that you're also spreading it locally to our other 5 hospitals. The St. Francis brand is going.
Right. So, when Dr. O'Shaughnessy, Patrick O'Shaughnessy, took over as CEO, he pulled me aside and said, Rich, you know, I've been with you since I was an ER doctor. I've been CMO like you were, and I know what St. Francis is, and I love it. But his role, my role as CEO of the system is, you're the service line director, and you got to do that at all other 5 hospitals. And he's guided me through that, where we basically, by the end of this year, we'll have cath labs at every hospital, and you could put a cath lab at any hospital. But it's the same technology I have at St. Francis, the same imaging experts I'm planting at each place, and we're pollinating our doctors at those places. So if you're at St. Joe's Hospital, which we opened up 2 years ago, you're going to get the same quality care that you get at St. Francis or Mercy, St. Catherine's, Good Sam, and eventually St. Charles. He asked me to do this. He goes, I want the brand everywhere, and that's what we're doing. We have our imaging experts in CAT scan, our interventional, EP, Dr. Levine is bringing the EP, George Pajosin is bringing the structural. So, you know, it takes longer to do. It's easy to say.
It's amazing, right?
But it's going to happen.
Yeah, I love it. It's great. You hit on your son, Evan. So Evan, amazing, is an osteopathic graduate, my alma mater.
Right.
As I understand it, he came out of fellowship with over 100 publications or something in that range.
Well over 100, yeah.
What is it like working with you? So I have a 4-year-old, so I only dream of this.
Well, I have 3 sons. And again, coming from nothing and working hard and then becoming successful, I said to my 3 boys, I don't care what you do, just be a good person. And because I worked so hard, it was very fortunate for my boys that my wife raised them.
I met your wife. She's amazing.
She is the rock. She is the best. You know, when I told them you could do whatever you want to do, and my son Evan said, you know, basically, I never got to see my dad, so I'm going to go into medicine because I want to see my dad. And my youngest son, Corey, said, I never saw my dad, and I really want to be with my kids, so I'm not going to be a doctor, which is interesting.
Interesting, right?
You know, it's like and you know, it's an interesting play there. And my oldest son is the smartest. He doesn't do any of that. He's a musician and he writes music. So
he's amazing.
He's
a Shlofmitz,
but they're all good kids.
Yes.
But my son Evan, it's interesting. It's like people say it's the greatest thing working with your son, and it is. There's a lot of great things, but it's also, you know, anxiety producing because you want him to be great. You want to watch him grow. But he's so busy and I'm so busy, and he's traveling all over. And I've seen him develop over the last 4 years. We were just at a conference in Detroit, and I was watching Evan present. And I remember from when he first presented, when we first did our first research thing several years ago now, and I'm saying, oh my God, this is unbelievable. So on a daily basis, I don't see him that much because we're both working crazy separately, but he's really kind of proud.
No. All right, let me change topics. My favorite Rich Shlofmitz thing of everything is your phone. How come everybody has your cell phone number, and what's with that access? Nobody offers that level of access.
My secretaries always laugh when a patient comes in and said, I'm a VIP, I have his cell phone. And my secretary will say, and so does everyone else on Long Island.
Exactly.
But if you call motor vehicle trying to find out if your car was registered and you put on hold and they say, we'll call you back, it's unsettling, right? But now take it to another level. My husband's having chest pain. I called the doctor's office and I left a message on the answering machine. I don't know if anyone picked it up, if I didn't know when he got it. I call again, I leave another message. It's 3 hours later. Do I take him to the ER? What do I do? How unsettling is that if you're a patient, especially if you're a cardiac patient? So to me, instant access and availability takes the anxiety away from a patient.
Rich, one of the also amazing things is that suddenly about a year or two ago, you showed up on TV. A really incredible digital series, The Heart of St. Francis. What was it like being followed around by a camera all day, every day?
You know, one of my patients is in production business and he was following around. He goes, you know, you should really have a reality show. Who's going to turn down a reality show, right? You know when you see a TV commercial for a Broadway show and the people walk out, I laugh, I cried. What I love about this is it's reality. It really is reality. And you laugh, you cry, you live with us through it. You see life and death. You see camaraderie with the staff, ups and downs, and it's 5 30-minute episodes that really gives you a flavor of the Heart of St. Francis. And the Heart of St. Francis is not one person. The Heart of St. Francis is our whole team. What separates us from everyone else is our team. And if you're a patient at St. Francis or Catholic Health, you will never go anywhere else.
I love that. I love that. We can bottle that and sell that. So amazing. I always try to end with two questions. The first is, what do you do for fun? Okay. And the second is, do you have one pearl of advice for the young, medical student who says, I don't know what to do with my life. I don't know what kind of doctor I should be.
So what I do for fun is, fortunately my wife, as we mentioned, is really amazing, but I spend many hours here. I get here at 4:45 in the morning, I leave at 9:30 at night, but my wife waits for me every night, and we have dinner out 7 nights a week. We live in Manhattan, and we have dinner out every night. And I travel all over the world lecturing, and she comes with me everywhere. So we figure out how to make it work. She takes care of the grandchildren during the daytime, and at night we have dinner, and when we're traveling, we travel and we see different cities together. So what we do for fun is traveling and eating. And I like to cook as well. My father was in the cooking area when he was working, and I worked many years cooking in different places. So that's relaxing and it's fun for us.
I think I've seen you on Monsignor Vlohn's show. Yeah, very, very. I love that. That's great. What's the latest recommendation of your favorite restaurant in the city right now?
My favorite restaurant in the city is Polo Bar on 55th, Ralph Lauren's Polo Bar.
Yeah.
And what's nice about it, it's a beautiful place. It makes you feel good when you walk in. The people there are really nice and friendly. The crowd is a lot of celebrity watching, and there's something for everybody to eat there.
Sounds like St. Francis.
Yeah, that's right.
All right, last thing, piece of advice. Young medical student, first-year medical student, medicine's a scary world.
So you got to do something that you love. You can't work this hard and be under the stress if you don't love every day of it. I probably have done more angiograms than most people in the world. And people say, oh, gee, aren't you bored when you do it? But every time you go in there, someone's life is in you. It doesn't, not to sound too dramatic, 99.9% of the time, everything goes smoothly. But someone's life is in your hands. If that doesn't get your heart rate up and get you motivated, something's wrong. So you need to love what you're doing, whether it's dermatology, pediatrics, psychiatry. You got to love it. So pick something that you're going to wake up 40 years later and say, I love every day of my life.
Your passion shines through every day, and our patients, your patients, St. Francis's Catholic Health patients are benefit tremendously from it each and every day. So thank you for taking the time. This has been amazing, and keep up the incredible work.
Thank you.
Thank you, sir.